Hello, everyone. My name is Jena Floyd, and I'm with the Hearing, Speech, and Deaf Center. I'm a client advocate, and I'm here interviewing Dilpreet Kochhar, who is from Gay City. I'm pleased to have an opportunity to talk with you more about the services your agency provides and what you all do. My first question is, can you just tell us about the work of your agency and what you do there?
Thank you. My name is Dilpreet and I use she, her pronouns. And so a little bit about Gay City is that one of the goals of Gay City is to be a hub for the LGBTQI community to be in a space where they can ask for assistance and needing support and things that'll help attain access to well-being. One of the goals specifically at Gay City, which also has a wellness center, is to help folks attain access to healthcare insurance and also have access to preventative services that include HIV and STI testing services, as well as attaining access to pre-exposure prophylaxis, which is a prevention method that reduces someone's risk of attaining HIV. We have multiple programs throughout our agency that are led by amazing individuals who work specifically on extending resources to community members, do outreach, as well as work specifically on an individualized level with LGBTQI youth.
That's great. It's wonderful that you do provide those services to the community. That's fantastic. Can you tell us a little bit more about the PrEP Navigation and Wellness Center? What services do you provide there?
Definitely. The Wellness Center at Gay City has a 3-month PrEP program that consists of goals that include educating community members about PrEP and what PrEP implementation means. Also helping folks attain access to PrEP financially. So going through financial administrative aspects of attaining access to a prescription medication and making it as low barrier as possible for folks. In addition to that, the most finalized goal that we have is to ensure that folks get connected to long-term care so they can get all aspects of their well-being addressed in one place. And so our PrEP program methods are based off of working with specific community members individually to ensure that they're having the smoothest journey that they can with pre-exposure prophylaxis.
That's really cool. That's great. Thank you very much. And it's wonderful to have those services available to the community. Are there costs involved in your services?
There are no costs involved in the services provided at Gay City. Everything is donation based and we don't turn anyone away from attaining access to services.
That's great. That's good to know. That's very important information. Who would be eligible for your services?
Good question. Our HIV and STI testing services specifically encompass individuals who are 15 years of age and older. However, due to our agency specifically focusing on providing low barriers to attaining access to resources, we don't ask individuals for their information upon receiving services. So if someone were to come in under the age of 15, we would not turn them away from attaining access to services if they presented a situation where they really need those services.
That's good. And what kind of advocacy do you do?
So I specifically focus on health advocacy, prevention, and helping community members navigate systems that present high barriers in attaining access to resources and health services. Gay City as an agency focuses on multiple aspects of not just navigating healthcare systems, but also presenting resources for folks who are seeking mental health services, social services, and navigating, trying to attain access to shelter, food, basic necessities even. And there are multiple teams within our agency that work on those incentives for the community.
That's great. And I'm wondering if deaf people have access to your services.
Yes, traditionally as an agency, we've had the privilege of having a team member who has been well versed in ASL in order to support that community. However, during the pandemic, things have changed environmentally, societally, and economically. And so we don't have the same team members on site working with us while our wellness center has been open. I've had the privilege of working with this community, with them being very well prepared and humbling me with the support that Gay City has to show up for still for this specific community. Our intentions are to continuously work with HSDC to see and analyze ways in which we can better show up for this community and work with them to provide translation services to our community members seeking that form of communication. And so our intentions are to move better, to move forward doing better with these community members.
That's awesome. Thank you so much. And it's so great to know we have these resources available to the deaf community, especially LGBTQI members who are able to access the services that you provide. I really appreciate your time today. Thank you so much for talking with us. And there we go.
Thank you.
Thank you.